The time is just gone 20 minutes past 8 a.m. And if you have just joined in, we welcome you to the show. We'll welcome our listeners at Salam Media and Al Ansar from Durban 90.4 FM, Peter Marisburg 105.6 FM. We welcome you to the show this morning. And we kick off this morning talking about the Children's Hospital Trust. And this morning we joined on the line by Aieysha Solomon, who is a trustee of the Children's Hospital Trust, because this is a hospital that is entirely dedicated to children, and particularly looking at children from impoverished communities throughout Africa. So this is absolutely important. This is critically important because when we're talking about children, we're talking about the welfare of our children. And when we have hospitals that are dedicated just for children, absolutely important, absolutely critical. And to tell us more, we are now joined on the line by Aieysha Solomon. And just to remind our listeners and viewers that this interview is coming to you live from our studios, and it is also coming to you live on our Facebook page on Facebook / Salam Media. Sister Aieysha, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh, Inayet, and to all the listeners out there. Jazakallah khair so much for having the Children's Hospital Trust with you today. And Ramadan Kareem to everyone.
Yes, Ameen, and we're certainly looking forward to a glorious Ramadan, inshallah. We know we've been through difficult times last year, but inshallah it will be a lot more easier. But let us talk about what we really need to talk about, Sister Aieysha, because this is important, this is absolutely critical. We're talking about the Children's Hospital Trust and the Red Cross War Memorial Children's Hospital. Who is this organization?
So, to all the listeners and Inayat, the Children's Hospital Trust was established in 1994, about 27 years ago, to advance child health care through the Red Cross War Memorial Children's Hospital. So if you look at it, the Children's Hospital Trust is a non-profit organization, and we are the fundraising arm for Red Cross War Memorial Children's Hospital. So we're based in the Western Cape, but the Red Cross Children's Hospital is the first standalone tertiary hospital exclusively for children in sub-Saharan Africa. So we not only service medical conditions within the Western Cape, but we serve them across South Africa as well as Africa at large. So basically that is who we are as the Children's Hospital Trust. What we do, we fundraise for Red Cross Children's Hospital, and we in support of fundraising for the Red Cross Children's Hospital, and we basically.
Sister Aieysha, I'm not too sure. I would want to get full value for this interview. You are breaking up slightly, so I just want to make sure that we hear you very clearly, because I think this is absolutely important. I'm just going to check with Ziad to see if he can do one or two fixes, inshallah, because you are breaking up slightly. Yes, we are talking with Aieysha Solomon this morning, and as she was talking about the establishment of this hospital, 1994, to advance child health care for the Red Cross War Memorial Children's Hospital. And there is just so much that they are doing at this point in time. There's a major project that is on the go as well. And at this point in time, there is an emergency center upgrade that we have learned, and this project obviously is significant. It costs something like 122 million rand, and they still need a lot more. They need close on to 8 million rand to complete the project. Sister Aieysha, you're back with us?
Yes, I am. Assalamu alaikum.
Okay. Wa alaikum salam. Much better. I can hear you much clearer now. Well, Sister Aieysha, let's talk about, obviously, I've been talking about this major project, and this project, which is the emergency center upgrade, and the cost is quite phenomenal, and you still need a lot more money.
Yes, we do. So last year, we started raising funds for the emergency center. The total amount of the project is 122 million. And last year we completed phase 1 and handed it over in October 2020. This was the building, the emergency center building that we needed to upgrade as well as expand. This year, we're focusing on raising funds for equipment in the emergency center. We have a shortfall of 8 million that we still need to raise. And hence why I'm on the radio today and appealing to the community out there to assist us in raising the shortfall of 8 million. For the month of Ramadan, we've aimed to raise 4 million for equipment in the emergency center.
Yes, now obviously you are using the month of Ramadan, obviously, as part of the campaign to raise funds. And I know last year you had raised funds on ITV, which obviously was on a pledge line as well. And I suppose you are going to be making the same appeals this year round, and you also be looking at this campaign for raising funds during the month of Ramadan.
Yes, we are. So we're continuing with our campaign for the month of Ramadan for equipment. And the equipment that is needed within the hospital is it varies from a price range from 125,000 right up until 1 million. You know, Inayet, there was a little patient from Pretoria that was transferred to Red Cross Children's Hospital last year. He had a problem with his breathing, and he got all the care that he needed at Steve Biko Hospital. Unfortunately, he needed additional care, and for that reason, he got transported to the Red Cross Children's Hospital in order for us to assist him with one of our programs that we have at the Red Cross Children's Hospital. So to the viewers out there, I'm saying to the listeners out there, and everyone viewing as well, this is the importance of what we need and how much we need to raise funds for, and what we need to raise funds for the children in the hospital itself.
Yes. Now, certainly, when one looks at the impact that the Children's Hospital, the Red Cross War Memorial Hospital, has made on families, on children. And you cited the one example of this child out of Pretoria, but I'm sure there are thousands right across South Africa that the hospital obviously treats and takes care of.
Yes, so in terms of the impact in terms of patients and staff and their families, the emergency center is a perfect example of how the upgrade has assisted the staff, patients, as well as the families in the hospital. So what happened? Some donations that we received last year from our generous community, we were able to complete the expansion of our emergency center, where we now have a dedicated family room that is more comfortable within our waiting areas. We also have dedicated isolation centers, rooms. We also have an easier flow for the staff of the Red Cross Children's Hospital to actually see to the patient that's coming through the doors of Red Cross Children's Hospital. So through this expansion, we were able to give better care to sick and ill children that is coming through the doors of the Children's Hospital, right? And the donations will only allow us to heal more children and to just make the lives of the doctors and the nurses so much easier. But also in terms of the patient experience, to make the patient experience easier so that they can be in a more comfortable environment when they visit the Red Cross Children's Hospital, and the doctors are able to actually to see them, take them through the procedures, nurse them and care for them a lot quicker and move more patients to the Red Cross Children's Hospital.
Yes. Now, I know you mentioned that these funds are required for equipment. If you could just tell us, what type of equipment is needed at this point in time, and also looking at some of the costs that are associated with the equipment that you need to acquire.
Inayet, I'd like to highlight three equipment that we need out of the entire list. So a basic thing that any hospital needs is beds. We need it's a bed trolley, and it's got an X-ray facility with that. Um, that trolley is a specialized service that's allowed for X-rays and allows patients to travel from the ward um, to the different departments. For example, if they need to go and do X-rays, this bed on its own costs 209,000. And for the emergency center, we need at least 4 of these beds. So before, some of the experiences that the doctors would experience within the emergency center itself, and I spoke to one of the doctors a couple of weeks ago, but there was a time when there wasn't enough beds in the emergency center, where they actually have to put 2 children on one bed. So yes, we definitely need a bed. We also in need of resuscitation trolleys. This costs 20,000 rand. 200,000, 20,000, 4,081. And then one machine that was really important, and we utilized it a lot around COVID-19, was the EVO machine. This is the machine that allows us for respiratory illnesses, but it allows us to transport the patient. So it's a portable respiratory machine and allows us to transport the patient from the emergency center or from the ward to ICU. And this is also needed in the emergency center. And the cost of this machine is 125,000.
Yes, obviously the appeal is gone out, and once again we are giving you, Sister Aieysha, the opportunity to appeal to those who are watching us today, to those who are listening to us today, to obviously donate funds, and more importantly, to look at it as a sadaqah, as sadaqah jariyah.
Most definitely. Inayet, you mentioned it now. This is perpetual charity. This is a sadaqatul jariyah. This is the charity and the giving that keeps on giving. We are treating our most vulnerable in our community, who are our children. Our children are young. They have the potential to reach an amazing future. And the hospital is standing now. And in order for the hospital to continue standing, is we need the donations of our community out there. So this is the charity that keeps on giving. A child goes up to an adult, and the hospital will continue serving the community as long as it stands. So most definitely, this is the best form of sadaqatul jariyah that our community can donate to, and we are appealing to you to give your perpetual charity to the Children's Hospital Trust. Donate to the Red Cross Children's Hospital.
Just in terms of information for people wanting to donate, how can they donate? Who do they contact?
So in terms of those that want to donate, we do have a fundraising office that can be contacted. We are open daily. Our contact number there is 021 686 7860. And for that, our fundraisers in the background are excitedly waiting for your call. You will also WhatsApp us on 071 22 44 777. And then to all those that would like to donate online, we've also got our online portals, our website you can go to is childrenshospitaltrust.org.za.
Yes, now I believe you're obviously looking at the pledge line once again this year, the ITV Pledgeathon, and that is going to be taking place sometime this week as well, Sister Aisha.
Yes, Inayet, we are very, very excited about our page line this year. The team has been planning since the first of line already, and we are on the brink of it. Our page line is happening on ITV Network, channel 347, on this Friday, the 16th of April at 9 p.m. So we will be on our pledge line from 9 p.m. right up until 12 o'clock for 4 hours. And we are very, very excited to engage with our donors. Call in, make your pledge, call in live, share your stories with the panelists and the rest of the viewers out there. So play your part in building the part of the Red Cross Children's Hospital, as well as equipping the Red Cross Children's Hospital with equipment, so that I say that when you actually drive past the hospital, you see the hospital, you can feel comfort within your heart that you were part of building such an iconic building.
Well, Sister Aisha, Jazakallah khairan for that and for coming on and talking with us this morning. And obviously, we can't emphasize enough in terms of how critical, how crucial this is. And particularly when we are talking about children, we're talking about making a difference to the lives of our children. And inshallah, Allah make it easy for you. Allah make it easy so that you realize your goals for this year and raise the necessary funds for the much needed equipment that you are raising funds for this time round. And we wish everybody else at the hospital, at the Children's Hospital Trust, a wonderful Ramadan as well, inshallah. Remember us in your du'as, and we will remember you in our du'as as well, inshallah.
Ameen, inshallah. Jazakallah khair. Shukran so much, Inayet, for having us with you today. But also, I'd like to thank all the generous donors out there that has pledged before, that has fundraise, give your donations to the Children's Hospital Trust, and to all of those that will be calling us on Friday, inshallah.
Inshallah, Jazakallah for that, Sister Aisha. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Aieysha Solomon joining us this morning, the Children's Hospital Trust and the appeal for funds. We are going to go for a quick break. We'll be back. We'll be talking with Advocate Shabnam Mayat.